and welcome. In the last 1.5 years, schools have been shut across the country, altering the lives of parents and children in many ways. Now, as the pandemic is declining, experts are saying that schools should open up. More particularly because all the data that is available with us shows that children are not particularly vulnerable in the expected third wave of the pandemic. Experts say that schools should be cautious and open up in a calibrated way. In fact, world bodies also like the World Health Organization and the Unicef are asking for open up. In this episode of COVID 360, we'll tell you what the experts are saying, and we'll also tell you how states have now started to open up schools. I'm Sneha Mordani. First up, after India Today spoke to Dr. Randeep Guleria, who said that schools must open up in a staggered way, experts, about 50 of them, have suggested ways as to how schools can go about opening up. I filed this report earlier. It is the cost of pandemic paid by the silent victims, devoid of schools, friends and quality education. And now experts are taking up the cause of children, writing to chief ministers of 3 states, backing reopening of schools.
India is one of the countries in the world where schools have been closed for the longest period. Children cannot continue online learning indefinitely. So what is needed? Informed dialogue, a process to live to this new normal.
Epidemiologists, vaccine watchers, virologists, all of them citing evidence saying that pre-primary and primary school students are at the lowest COVID risk and their classes could begin first. The government policy makers also agree.
Young children, it has been established, have lower number of receptors. That is, the ACE receptors is much lower in children where the virus attaches.
Sources within the health ministry say that they'd rather be cautious about this decision and that states should take a call on whether they want to open up schools and how they want to do it. If at all there is an infection in school, states have to ensure that containment is effective. They have to ensure vaccination among teachers and school staff and also ensure that within the school, COVID-appropriate behavior is maintained. The Education Ministry, however, has asked for a report on the number of teachers and school staff that have got vaccinated across states. Vaccines for children are under development in India, but countries like UK have decided against universal vaccination for young children. Children under 12 are not being vaccinated anywhere in the world. Experts suggest a task force to plan reopening of pre-primary and primary schools partially first to test implications. This can be followed by staggered reopening in areas with low positivity. They also back priority vaccination for school staff with reduced gap. To begin with, small groups of students can attend school once or twice a week. Schools can meanwhile upgrade infrastructure for transition from online to hybrid model. Experts add that India should have prioritized vaccinations for teachers and school staff and made a mistake by not designating them as frontline workers. In New Delhi, Sneha Mordani for India Today. Classrooms without children. This is what the UNICEF is extremely worried about, saying that this can't go on any longer. It's been over 500 days of no in-person schooling for children across the world, including India. The World Health Organization also is listing out a series of suggestions, asking countries to use those suggestions, incorporate them and start to open up schools.
Reopening schools can't wait. This is what UNICEF has said in strongly worded universal statement. It's been 18 months since the Covid-19 outbreak started and education for millions of children is still disrupted. As of today, primary and secondary schools are shuttered in 19 countries, affecting over 156 million students. This should not go on. Schools should be the last to close and the first to reopen. The world over, the debate is raging on whether schools should open, and if yes, how should one go about doing it?
Sources within the Health Ministry say that they'd rather be cautious about this decision and that states should take a call on whether they want to open up schools and how they want to do it. If at all there is an infection in school, states have to ensure that containment is effective. They have to ensure vaccination among teachers and school staff and also ensure that within the school, COVID-appropriate behavior is maintained. The Education Ministry, however, has asked for a report on the number of teachers and school staff that have got vaccinated across states.
The Lancet COVID-19 Commission India Task Force recently recommended reopening of schools in a phased manner as COVID-19 cases decrease.
It is time now to think of an evidence-based solution to reopen the schools. But these solutions will have to be very specific to the context, to the local settings. At the same time, we should also take care of every piece of evidence that is available there.
More importantly, experts say the cost of keeping children at home is particularly high given the digital divide in Southeast Asia and the Pacific. 80 million children had no access to remote learning while their schools were closed.
Those marginalized children who don't have access to the internet or electronic media and therefore are not being able to attend the schools and have sort of dropped out of education, we need to develop a strategy that all of them can come back to the education system, and that's why physical classes should start.
Experts also say that children are not more at risk to infection as was believed earlier.
Children and adolescents are more likely to present with a mild or asymptomatic infection and are much less likely than adults to be hospitalized or have fatal outcomes. Viral load studies suggest that children with symptoms carry as much virus in the nose, mouth, and throat as adults, but for shorter period.
But there are those who still believe that given the uncertainties, not sending children to school is a more pragmatic option.
Children are vulnerable, they can get severe infections too, so we need to be extremely careful and on guard. Therefore, it is of paramount importance that we immunize children and immunize them quickly. Opening of the schools at the present moment would still be risky. My advice is to vaccinate first, vaccinate the children and the school teachers before we embark on opening schools.
In a scenario where the trajectory of the pandemic can't be predicted, experts say this is the best possible solution, considering vaccination for kids is still a long way off. With Sneha Mordani, Bureau Report, India Today.
Identify children with comorbidities and vaccinate them as priority groups when vaccinations for children open up. This is one of the suggestions of India's top virologist, Professor Gagandeep Khan. She spoke with us earlier. Do you think that India made a grave mistake by not vaccinating school teachers and staff as frontline workers that we could have opened up earlier? Even now, we have staff and teachers who are not vaccinated.
I think it is a priority to ensure that staff and teachers are vaccinated as quickly as possible. And when vaccines become available for children, we should particularly now be identifying children who have comorbidities of any kind and making sure that they are prioritized for vaccination when it becomes available. Okay. But in terms of non-pharmaceutical interventions, when generally disease is low outside in the community, we don't expect for schools to be different from the outside community. But because respiratory infections spread easily in children, monitoring will continue to be very important.
There is, in fact, Professor Kang, a raging debate right now on opening of schools in India. India has started, some states have done so cautiously, steadily. Do you think this is the right time given the apprehensions around opening up of schools?
Well, I think it's clear that we have to open schools at some point. It's also clear that if we look at infections from SARS coronavirus 2, children tend to have less severe disease as a proportion of all infected individuals than older people do. So I think with caution and with calibration, this is something that can be done. Being ready at any time to roll back in-person school attendance.
Okay.
There are some things that need to be attended to. Ventilation is clearly important. Vaccination of teachers is important. And making sure that masks are being worn and that there is a careful monitoring of both symptoms as well as some level of testing.
Okay. What could have been done differently to ensure that children didn't have almost, 2 years of time at home? Because we know that this has had a deep bearing on their mental health as well. Professor Khan.
I think the situation that we've been through for the last several months was not one where it was a good idea to take children and put them into enclosed spaces with teachers who were unvaccinated. So if we think about a time for opening up, I think we are at the right time now. But as I mentioned, this needs to be a calibrated, cautious approach so that if cases do start to go up, this is something that can be rolled back again.
Okay.
The damage done to children who have not had access to online education is much, much more than the damage done to children who were at least able to attend school online. But I think the one thing that we have recognized at this time, this year, that we didn't know as well 15 months ago is the importance of ventilation. And I think all schools should be evaluated to make sure that there is appropriate air handling and that there is sufficient ventilation.
Many schools like this one have not been able to open up because the governments have not yet decided. But there are some schools in states that have started to open up. Here's a ground report from a couple of states that are seeing schools open their doors to children once again.
It is back to school for these children, and the joy is more than evident. After all, for more than one long year, the computer screen was their only classroom.
घर में इतने महीने रहे आप, आज स्कूल आ रहे हो, कैसा लग रहा है?
अच्छा लग रहा है। बोला है कि मास्क पहन के आना है, सब पूरी वर्दी और अच्छे से कापी किताब वो सारा काम पूरा करके।
Punjab, Uttarakhand and Chhattisgarh took the lead by resuming physical classes. Punjab opening schools for all classes.
Schools in Punjab for classes between 1st standard to 9th standard will be opening first time after a long gap. Remember, classes for 10th, 11th and 12th standard are already going on from 26th of July.
Locked up in their homes all this while, the excitement to return to their school could not be missed.
घर से बोला था मास्क मुंह से उतारना नहीं और सैनिटाइजर करके रखना।
अच्छा, तो कितने टाइम बाद आप स्कूल आ रहे हो, कैसा लग रहा है आपको आज?
अच्छा लग रहा है।
While students are happy, school management is also on tenterhook, taking every measure possible to ensure that their premises remains COVID-free.
सोशल डिस्टेंसिंग के लिए हमने बच्चों की जो स्ट्रेंथ है क्लास की वो 50% की हुई है, तो अप्रॉक्सीमेटली एक कमरे में 15-16 के करीब बच्चे बैठेंगे, इससे ज़्यादा नहीं बैठेंगे। अगर उनका मन मानता है तो वो बच्चे को भेजें, इट्स नॉट कंपल्सरी। पेरेंट्स की कंसेंट लेके ही हम बच्चे को क्लास में बिठा रहे हैं।
The hill state of Uttarakhand has also opened schools, but only for students between 9th and 12th standard.
बहुत अच्छा लग रहा है, मतलब जब मैम ने बताया कि 2 अगस्त से स्कूल खुल रहे तो हम पहले ही से मतलब ड्रेस जो बुक्स थे हमने लिया। हम बहुत एक्साइटेड थे कि इतने दिनों बाद हमारा स्कूल खुल रहा है, हम पढ़ेंगे, क्योंकि पेपर भी अब होने ही वाले हैं हमारे, तो हम बहुत अच्छा लग रहा है हमें स्कूल आके।
While these children are thrilled to return and meet their friends, parents are still worried.
बस यही हुई है भी दूरी थोड़ा रखन, ठीक है, मास्क लगा के रखन ਤੇ ਬਾਕੀ ਸਕੂਲ ਵਾਲਿਆਂ ਨੂੰ ਵੀ ਅਸੀਂ ਕਹਿੰਦੇ ਆ ਵੀ ਤੁਸੀਂ ਪੂਰਾ ਬੱਚਿਆਂ ਦੀ ਸੇਫਟੀ ਲਈ ਜੋ ਵੀ ਬਣਦਾ ਉਹ ਕਰੋ।
Chhattisgarh has opened its school premises, but only for students between class 10 to 12.
आज हम लोग बहुत दिन बाद स्कूल आ रहे हैं तो मुझे तो बहुत अच्छा लग रहा है और ऑनलाइन क्लास पढ़ के बहुत बोर भी हो गए थे और फ्रेंड से भी मिलने को मिल रहा है।
बहुत एक्साइटेड है हम लोग टीचर्स लोग से मिलने के लिए, सब न्यू फ्रेंड्स, न्यू टीचर्स, तो बहुत ही ज़्यादा एक्साइटेड है हम लोग।
Even Uttar Pradesh has now decided to follow. It will be opening its school doors at 50% capacity from 16th of August. Reopening schools when the COVID pandemic is still raging on is a tough decision for any school to take. But in states that are now witnessing a lower number of cases, it is time perhaps that normalcy returns for children of India. With Manjeet Sehgal in Chandigarh and Dilip Rathore in Dehradun, Bureau Report, India Today.
We're pausing here for a quick commercial break. Much more on the other side.
And that's why I always go for the best, to stay comfortable, even on the move. With all black leather captain seats, the XL6 is designed for absolute comfort. XL6 feels just right.
There's no greater arena, no bigger track.
The one true pinnacle of sports. New champions will be born. Old records will be broken.
As the Olympics journey begins, the nation cheers in one voice.
Go India, go for gold.
Go India,
Go for gold.
go India.
Go for gold.
Go India.
Go for gold. Go India. Go for gold. Go India. Go for gold. Go India. Go for gold.
There was a scare in Solapur in Maharashtra where schools opened up and 616 infections were seen in people in this area. Here's what happened.
With COVID cases finally receding, several states have reopened schools. Maharashtra, which saw the cases dip in May in areas where no COVID cases were reported in a month. State Education Minister Varsha Gaikwad had said it was important to resume safe schooling. Solapur was one district where many schools reopened. Since children went back to schools in Solapur, 613 students have tested positive for COVID. The administration says there is no need to worry. Solapur's COVID graph has risen from 281 cases on 2nd July to 691 cases on 1st August, even as 27.4% of the population got one dose of the vaccine. With cases rising and no vaccines yet for kids, there are fears that kids could act as spreaders. Bureau Report, India Today.
I also spoke earlier to Dr. Poonam Khetrapal Singh, the head of the World Health Organization in the Southeast Asian region. And she said that schools must open up and take a series of measures, including ensuring ventilation, given the fact that it is well established that COVID-19 indeed is an aerosol infection and gets carried within indoor environments and gets transmitted more effectively. Here's what she told me.
It is over a year and a half and the pandemic is still around. It is a long haul. How long, we really do not know. Hence, like other sectors, we need to consider graded or gradual reopening of our schools. This is already being done in many countries. Closure of schools for a long time is not only impacting education, but also development, social and mental well-being of our children and adolescents. There are three important factors that need to be considered. First is risk assessment. Local epidemiology, that is gauging the virus transmission levels through positivity rates, testing capacities, and overall capacities and performance of the health systems. Risk assessment is key to any decision to strengthening or ease public health and social measures. Second is risk mitigation. Measures to control virus transmission in school settings should be specific to the needs of different age groups. The overall strategy should be limiting contact between children by reducing class size or staggering classes, ensuring enough facilities for hand wash and wearing of masks, and ensuring hand washing facilities with running water and supplies of soap, sufficient and adequate toilet facilities, enhancing fresh air ventilation. While it is of utmost importance to contain the pandemic, children must also be able to continue to study. At local level, this educational need should be weighted against the risk of further spread of the virus. In 2020, of all COVID-19 cases reported by countries, children and adolescents under 18 represented around 8% of cases, despite comprising 29% of the global population. Children and adolescents are more likely to present with a mild or asymptomatic infection and are much less likely than adults to be hospitalized or have fatal outcomes.
That's all we could pack in this edition of COVID 360. You can catch that episode and much more on our website as well. That's indiatoday.in. You can also download the app. Hope you enjoyed the show. Until next time, stay safe, be well, and do get a shot against COVID-19 if you haven't already. Thanks for watching.